It's good to be back with you. I've missed you. Even though we've been on the phone together nonstop all the time, but
you got the right poster to follow the Dr.
We do.
Chris there, yeah. Mental health.
Mental health. I know that a lot of us have probably had our moments during this difficult time, you know, I guess I'll start there because reflecting back to how this all started, you know, it caught us. I think it caught most everybody by surprise. They didn't realize when they heard coronavirus maybe appearing in Wuhan or other places, what it would mean to them. Eventually, when it became a health crisis here in America, and you know, when Dr. Acton you know, started out, she was warning us about all of the consequences of it, and the governor, you know, to his credit, took swift action. I truly believe and will always believe that those swift actions put us in a great position today and forever going forward, because we didn't get overwhelmed by the coronavirus, that those protections, and to the credit of everybody in Ohio, your just team spirit, doing what you needed to do to keep yourself safe, your neighbors, your family safe. You know, those policies and practices squashed the curve, and but we know it's not going away. You've heard all of these things before. It's going to be with us for a long time throughout 2020, and Dr. Acton has been very articulate at expressing the fears surrounding that, and I know that this weighs heavily on the governor's heart and mind as he has to make decisions about these difficult policy issues. But I have spent, you know, a lot of my time as it relates to the economic side of the crisis, because it's not just a health crisis. Over time, it has become more and more of an economic crisis. And I want to today spend a little time putting that in perspective for folks. In March of this year, just at the beginning of March, we had 5.6 million people in Ohio working. That's how many jobs we had in our state. The economy was robust. We had a record low unemployment rate, and the biggest issue that businesses had was that they couldn't find enough people to go to work with all of the great opportunities that they were creating. And boy, how things have changed in a very short period of time. Since March 15th, we've lost about 1 million jobs in Ohio. Nationally, that number is well over 25 million, will be by the next time the jobs numbers are reported. Probably going to grow much higher than that. It's projected nationally by the people who look at this, and we all know modelers on the health side, modelers on the economic side. They think that unemployment could go to 20%. It could be as low as 15%, could be as high as 25%. No one really knows, but those are some of the best estimates about where things are. To put it in perspective, during the Great Recession, which ended in 2009, the highest unemployment rate we experienced in Ohio was 10.9%. Just 10.9% seems reasonable compared to these other numbers and these other projections. And we know what the economic consequences were during that time. We also know from past recessions, from what we've learned, that as unemployment goes up, so do the rates of suicide, drug addiction, domestic violence, depression, homelessness, as well as other health consequences like diabetes. Bad economic conditions lead to bad health consequences, and this is the reality that we face. Not to mention that in every economic downturn, it hurts people the most who are at the low end of the economic scale, not just on job access, but on wages and wage growth and being able to pay the bills. It weighs heavily on that part of the population, as the statistics right now bear out. And this is not to mention that there are many small businesses out there, and I've talked to lots of them, who are within days, weeks of running out of money, running out of cash, and many of them will potentially close, not just for a while, but forever. And there are other consequences of this. Economic consequences spread across a lot of what we do in life. If businesses are not operating and people aren't working, then state and local government don't have the revenue to serve our collective constituents. State and local governments cannot borrow. We must balance our budget based on the revenues that we have. As for mayors and cities, I had a regular conversation that the governor and I often have with mayors from across the state. Some of them told me today that in their budgets they're expecting between 15 and 25% cuts. And that will mean police, fire, and other vital services. For many cities, there will be no other place to go. As far as the state, we rely largely on income and sales tax. Income and sales tax. And we know that if people aren't shopping and they aren't out buying things in the economy, our sales tax dramatically suffers, as well as when people lose jobs, the income tax revenue suffers. During a normal recession, the $2.7 billion we have in the rainy day fund would suffice. But based on current projections, and we know we can change the curve just like we can in healthcare, we can change the curve, we can change our economic curve, but based on current projections, that $2.7 billion, well, we might need twice that amount just to balance the budget over the next 15 months. But this is not about government, not about public officials, and this is about people. This is about the people that those resources serve. It's about their lives, the things that they depend on. And we know that most of state government, well, most of state government funds things like education, our K through 12 schools, and our system of higher education, whether that's community colleges or our four-year schools, scholarships and things like that for young people. We also know it funds health and health care, from Medicaid to the many other services that Dr. Acton's health department and people are provided, as well as public safety. The effect of these consequences, will weigh heavily on children, particularly at-risk children. It will affect the cost of college and our ability to protect our neighborhoods. So economic consequences are not just about businesses. They're about the people that rely on these services. The reopening strategy is, as I just mentioned, not just about those businesses. It's about the economic engine that our social safety net depends on. And so we're going to fight back in many ways. Governor's going to talk to you about ways that he's been working on to fight back, and Dr. Acton's going to talk about things that she's going to fight back, she's working to fight back on. And in the coming days, we're going to talk about some of the things that we can do to fight back as far as best practices that employers have executed successfully around the world and in Ohio, because we know that many businesses have not shut down during this time frame. Many of them have been operating, and they've found strategies to operate safely. Now we know when we talk about the reopening and rollback of certain restrictions, that I'll reiterate this again because it's important, because I know how important this is for people to understand. That doesn't make the coronavirus any less dangerous, not at all. Particularly if you're over 65 and you have health issues, you're going to have to remain ever vigilant, and we're all going to have to remain vigilant to make sure that we're protecting each other. But others will be able to rejoin the economy and fire up the economic engine that will help us get through this. This is a fight. We use these terms: fight, battle, war. But you will be armed in this battle with masks and sanitizer and soap and disinfectants and 6 feet of safety and the various strategies that we know work at protecting people in workplace settings. And we all need to lead by example. We need to lead by example by demonstrating in our workplaces that we can do these things the right way. The road to recovery will certainly be long and gradual, but with the right precautions, businesses can create a safe environment for their employees and customers. And reiterating again, coronavirus is going to be part of our lives for a while. We just need to learn to live safely with it in our lives, protecting people's lives and livelihoods. Governor?